time, I would like to introduce you to our speakers for today, Rhonda Barkas and Shannon Studden. Rhonda joined the National Rural Health Resource Center in 2012 and manages the SHRT project in Population and Community Health Services. She has worked in hospital settings since 1987. Rhonda has experience in leadership and organizational development and has assisted hospitals to address the organization-wide goals related to improving patient experience and staff retention. Rhonda received her Master's of Science in Psychology from Georgia College and State University. She is also a licensed professional counselor and has worked in the field of substance abuse. Shannon Studden joined the center in February 2018. She provides education, coaching, and technical assistance designed to help rural health network leaders achieve their goals. With extensive experience designing and delivering educational programs and facilitating team events, Shannon brings expertise in the fields of leadership development, group processes, continuous improvement, and conflict management. Shannon has supported leaders and work groups in a variety of industries, including mining, public utilities, and healthcare. She has also taught classes in management, organizational behavior, interpersonal relations, and teamwork at the University of Minnesota Duluth. She received her Master's of Science in Industrial Organizational Psychology from the University of Tennessee at Chattanooga and her Bachelor of Arts in Psychology from the University of Wisconsin-La Crosse. On that note, welcome everyone. Thank you for joining today. And Rhonda, if you're there, I'll pass it over to you.
All right. Thank you so much, Andy, and thank you everybody for joining us today. I am so excited to be presenting on this topic. It's something I feel really passionately about and have worked on for years, and just really enjoy thinking through how to better impact patient experience. What we know is that it's important to be constantly seeking to improve the patient experience, not just because of HCAP scores, although those are important, but also because we know that this is about keeping the patients in our community and being the hospital of choice for them. And it's also the right thing to do for patients, because we know that when patients have good experiences in our hospitals, they feel safe and cared about, that we are really looking after their well-being. We know that people heal better. When people are nervous and anxious and feel like nobody's going to be there for them, then that impacts their healing. So this is an important topic on so many different levels. So just as a reminder who we are, National Rural Health Resource Center, we have worked for years to improve the health care in rural communities. We're the nation's leading technical assistance and knowledge center, and you can see the 5 areas that all of our work focuses on. The learning objective for today is we will be talking about new ways to ask questions to get the information you want in your leader rounds. I know that many of you already do leader rounds, but we'll talk about how to really craft those questions so you're getting some rich information. We're going to talk about how to make the patient comfortable during those rounds so that you can get the best possible information. And then we're going to talk about how to use that information to effectively coach the staff. So here's our agenda. I'm going to begin by talking about what I mean by rounding, how to prepare for the round, tips for those conversations, and then post-rounding follow-up. And then I will be handing it over to Shannon, and she'll talk about a model for coaching staff. The reason that we are taking this approach is because leader rounds is not an event, it's a process. And what I mean is it's not that we do a leader round and then that's it. Really, in order to make a difference with leader rounds, we have to use those not only to look at our processes in our hospital, but then to coach staff. It's really about bringing this entire thing full circle, not just gathering the information, but then using it to make things better. So when I talk about leader rounds, it's a focused and intentional conversation with the patient to identify areas where we have taken care of them successfully and opportunities to impact their patient experience in a better way. I think one of the key words here is intentional. This is not where we just walk into the room, how are you doing today? Yeah, how's your stay? And we just chat with them for a few minutes and we leave. I think to be really good leader rounds, they have to be consistent, and they also have to be very intentional. And that's why some of the stuff I'm going to talk about is going to feel really basic. You're like, well, yeah, but I think a lot of times we miss these pieces, and that's what makes the difference between a leader round that gives us our information and the ones that don't. I've been working with patient experience since about 2005, and this was prior to HCAPs even being rolled out live. It was when the hospital I was working in was actually preparing for HCAPs. And over the years, there are two components that I feel have made all the difference in impacting patient experience. The first one is a hospital. We have got to put things into place so that we are training our staff, helping our staff to really buy into the impact they have on the patient experience. And so there's so many different things hospitals do. Some use the Studer model, the AIDIT model. Some use the whiteboards in the patient's rooms. Some use some form of what we call the 5 Ps or the 4 Ps, which I'll mention a little bit later. But it's really about creating practices that are also about patient healing. What we know is that frontline staff are the ones that ultimately are driving the patient experience. So really helping to get them enthused and motivated and engaged to provide good patient experience is critical. Second to that, though, is leader rounds. This is the other thing that I have seen, especially in the last few years as we have gotten better and better at this, that has made all the difference in the world. And this is where we are really able to focus on what matters to the patients and how we're doing. And so that's what this is going to be focused on. I say all of this too, I know sometimes people use the phrase leader round to refer to leaders walking around the hospitals talking to staff about how are you doing, what can we do to help you do a better job. For this presentation today, I'm specifically using leader rounds to talk about when we go into a patient's room and we have a conversation with them about their stay. So this is just a reminder, those of you all are in healthcare, you are very familiar with HCAPs. It's a survey that has been out there for a while that is used to measure the patient's perception of their care. It has changed over the years. As you know, some questions have been added and some have been deleted because of unexpected consequences. So we used to have a lot of questions on there about, are we controlling your pain? And those have been removed because it was found that there were unintended consequences of people just opioid use and other things, because a lot of hospitals and providers felt the pressure to give the patient what they wanted so that the patient would be happy with their care. So anyway, this has transitioned over time. But HCAPs really just allows for a way for the patient, the patient's family, to look at HCAP scores for different hospitals to decide where do I want to get my care. And then it also helps, and it's also a way now and moving forward that it incentivizes hospitals to improve their quality of care. And again, 20 years ago, there was not a lot of incentive for that. So one of the roles for my job is with the SHRT project. After we support a hospital with a pretty big project, I do the outreach where I talk to the hospitals to find out how the outcomes have been. We talk about non-measurable outcomes, measurable outcomes. And so one of the the measurable outcomes we capture for every single project we support is HCAP scores. And when I'm talking to the senior leadership of the hospital, we're talking about their HCAP scores. Very frequently I would hear a leader say, this just doesn't make sense. I go into the patient's room, I talk to them about their stay, they tell us everything's been great, and so then we get their survey back, and that's not what's on the survey. And so what I'm suggesting is that perhaps if what the patient's saying to us in the room and what they're saying on the survey are two very different things, perhaps we need to ask different questions of the patient. And so that's what this is all of the intention of this, is to help you to think differently about the questions. I remember one of my first experiences with leader rounds was actually as a family member. My brother-in-law was in a very well-known hospital for cancer, and he was diagnosed with stage 4 cancer. And I remember my sister and my brother-in-law and I were in the room, and the nurse manager walked in, and she was dressed in this black suit. She had a clipboard in her hand. She stood over at the door, and she said, "Hi, I'm so-and-so, the nurse manager. I'm here to round on you all and see how you guys are doing today." And we were like, "Fine. Okay, well, how's your stay been?" It's been fine. It's been good." "Okay, well, is there anything we can do to improve?" "No." "Okay, well, just let us know what you need, and here's my business card if you need anything." And then she walked out. And I think that was kind of the old way of doing leader rounds, where it was one and done. We thought, go in and do this interview. And what I'm going to suggest is that we think about this very differently, so that it's not an interview of the patient, but it's really a conversation that dives deeper and deeper into the issues that are most important to the patient and to us. So I want to talk a little bit first about preparing for your leader rounds. And again, this sounds so basic, but this sets the tone for the conversation. If we do this well, it's going to set the tone for the patient that they want to open up to us and they want to talk, or they don't. Kind of like that nurse manager I mentioned before. There was nothing about her that was inviting or seemed very caring. Very clearly, she was all business, and it did not feel warm at all. And so the first thing we have to do is actually plan your introduction. And I encourage people to kind of write down and not script this for themselves, but to get some very intentional thoughts about how you're going to introduce yourself and what rounding is about. And so, you have to decide, do I introduce myself as the CEO or the nurse manager or the chief nursing officer? Or am I going to introduce myself as a leader? And then you got to tell people why you're there. What I discourage people from doing is to say, "I'm here to round on you," because again, that doesn't feel inviting. It doesn't feel warm. It feels like you're doing something to me. And so I have an example here of a way you might do this. And again, of course, you're going to make this work for your own style. "Good morning, Mr. Jones. I'm Jane Smith, the nurse director. I'd like to spend some time with you just to hear about how your stay is so far. Is this a good time to talk?" Or, "Gosh, I'd like to spend some time just chatting with you a little bit about your stay. Is this a good time?" So making it feel very friendly and warm and inviting, and not, "I'm here to round on you." Because one thing I want you to remember is that however the patient experiences you in the room with them during these leader rounds, that's part of the patient experience. So that's going to be reflected in HCAPs as well. Do they feel that you're concerned and caring about them, or is this just kind of one of the things on your checklist for the day? The other thing that I encourage folks to always do is to spend a fair amount of time really figuring out, what is it I'm looking for when I go into the room? So for instance, is there an area of patient experience that is really important to you? As I've worked with different leadership teams, one area of patient experience that seems to be critical for a lot of managers is responsiveness. Because when we are responsive to a patient and their needs and their wants and what's important to them, that's going to feel one way. When we are not responsive to them and patients feel like they have been forgotten or lost, or we don't care about them, then it's going to feel another way. So that's one of the areas a lot of the teams I've worked with have focused on, is diving down into patient experience. But again, for your hospital, you've got to decide, what is it I really want to drill down on? Are there expectations of the staff that you want to check on? So, for instance, I have here the 5 Ps, and some of you may or may not be familiar with that concept. The 5 Ps are, and by no means is this the only way to go. Some hospitals have 4 Ps, some have 3 Ps, but really it's where leaders and staff decide what are the things that are most important to our patients that we want to check on with them every time we go into the room. So the 5 Ps, for instance, stands for pain, potty, priorities, personal needs, and positioning, being repositioned to the bed. Are they comfortable physically? And so the hospitals that I work with, they're very, very frequently, the expectation is every time the staff member goes into the room, they are addressing the 5 Ps with the patient, because these are the things we know matter the most to most patients. These are the things most patients call for later that they need help with. On the slide, by the way, there's a link. A couple years ago, I did a webinar on patient experience and created some podcasts that you could use. And so this link goes to a podcast that teaches about the 5 Ps, but it was created in a way that you could use it to teach staff. If you decided as a hospital you wanted to do the 5 Ps, you could use it in staff meetings to teach staff how to do the 5 Ps, and it's just about 10 minutes long. The other thing I encourage you to do is to familiarize yourself with that patient's information before you go into the room. Check in with staff, get a little background on the patient, see if there's anything that they know of that would be helpful to you. You don't want to walk in without any knowledge of the patient and without kind of knowing where the patient is that day and what's going on. And so if you found out from the nurse or the tech that the patient has just had a really bad diagnosis, you're going to need to go in knowing that, so that you don't walk in with a huge smile, "Hi, how are you today?" And the family is just now getting this information and beginning some grieving. So we need to be sensitive to what the patient is going through. The other thing I encourage you not to do is to go in and say, "So what brings you into the hospital?" And again, a lot of people, I think, in leader rounds, they will use that as their introduction. But again, the patient is like, "Are you kidding? You're walking into my room and you want me to tell you one more person why I'm here?" Because they probably already told several people before. So again, going in so that they know that you know a little bit about them, and that gives you some credibility. So before I go any further into the leader rounds themselves, so this was just all what you do before the leader rounds. Next, I want to talk just briefly about this concept of intention, connection, and action. This is a concept that I teach leaders and frontline staff. And again, there's a podcast that was created that you can use to even share this information with staff. But intention, connection, and action means before I go into the patient's room and ask them about their stay, give them medicine, give them their dinner, take their vitals, that's action. Those are the things that we're doing to the patient. First, we have to get clear on our intention. I am a firm believer that every person who works in the hospital should have the same intention. It doesn't matter if you're dietary, environmental services, respiratory, leadership, the nursing staff, the pharmacist. My belief is everybody who walks into a patient's room should have one intention, and that should be, I am in here to do what I can to help this patient with their healing. That's what I'm here for. That's my intention. So getting clear about that, then we knock on the door, then we walk into the room, and then we connect with the patient. So this is where we walk in and, "Oh my gosh, those are some beautiful flowers. Who gave those to you? Oh, your grandchildren. How many do you have? Oh, they must really love you. Oh, I see that you're watching so-and-so on TV. You know, who's winning in the game?" So the key here is connecting with that patient in the bed as a person, not as a patient. So intention, connecting, and then the actions. And then we do the vital signs, give the medication. So I share this with you all because I do believe that leaders also need to keep this in mind, that when I'm going in to do rounds, I'm not going in just to do rounds. I'm going in to help with healing, and I need to follow these same steps. After the intro, after you walk in, you introduce yourself. Always ask, is this a good time for the patient? If they're in the middle of their very favorite show and we go in and we start talking to them, number one, it's disrespectful, and number two, you're not going to get someone who really wants to talk because they want to get back to what's going on in their show. So always ask, is this a good time? Because if they say no, maybe they're not feeling well and they don't want you in there right then. We need to respect that and say, okay, is there another time that would be better? And if not, then not. If they have the TV on, ask if they don't mind muting or turning it down a little bit. This piece is awkward for some people, but it is so important. If at all possible, ask them, is it okay if I pull up a chair and sit next to you? And if they say yes, you pull up a chair and sit next to the bed. A few things this does, it makes the conversation easier. If you are standing over them, talking to them, a lot of times that will feel uncomfortable, and we want to make this comfortable for the patient. And so if I'm standing over them, they're going to just want me to hurry up and get out. If I'm standing at the door, that tells them that, hey, I'm just sort of in here, but I'm really on my way out. To pull up a chair, sit face-to-face with the patient where you can make eye contact, makes the conversation feel so much friendlier, and you are more likely to get some good information. And then, of course, as I said earlier, finding a way to connect with that patient. So this, I think, is really interesting, and that we need to remember this. So those of you all familiar with HCAPs, you guys know that that one of the main questions on the HCAP survey is rating the hospital on a scale of 1 to 10. One of the things to remember is that to get credit for HCAPs on this item, the patient must say 9 or 10. If they say an 8, that's just like saying a 2. You get credit for the percentage of 9s and 10s as compared to other hospitals. So when a patient says, oh, everything's fine, sometimes we think, oh, good, everything's fine, and then we move on. Or they might say, oh, everything's great. But remember that fine is probably an 8. If somebody says fine, that means, yeah, everything's fine. Yeah, nothing bad, nothing good, everything's fine. That's a 6, 7, or 8 potentially. Even when somebody says, oh, everything's great. The key in really good leader rounds is to start digging deeper and start asking open-ended questions. And so, for instance, if they said, oh, everything's great, then I am going to say to them, oh, I'm so glad. So can you tell me what's made your visit with us so great? Because if I ask that question and the patient goes, that tells me it's not great. It's probably fine, and that's just the word they used, is great. Because when somebody says it's great, they have a story to tell. They have some specifics. So when somebody says great, and I say, oh, great, tell me what's made it great, and they go, oh, my nurse, Mary Lou, is so kind. It seems like she just knows what I need before I ever ask for it. She treats me like family. So they're going to have a story. And then at that point I might say, oh, I'm so great. Yeah, Mary Lou's a really great nurse. Anything else made it great? Oh, my gosh, I love the guy that comes in and cleans my room. He's always singing spiritual songs, and it just makes my heart feel so good. So they're going to have stories, and that's what a 9 and a 10 is about. So again, if you're not getting those, then that helps us to know that we need to be working on what do we do in our organization to help create those amazing stories for patients. The other thing is if somebody says, yeah, everything's been great, oh, your staff has been so good, everybody's really kind, then you would ask something like, well, so who stands out to you? Oh, well, you know what, there's just one tech and I can't remember his name. Oh, well, does he work days or night? Oh, he's at night. Okay. Well, what does he do that's so great? And then they will have a story to tell. And that's when you know that this is not just fine as a 6 or 7 or 8. So some ideas about crafting your questions. And again, if you haven't already picked up on this, this takes some time, and it really does take some intentional thought and not just winging it. And it also takes practice. So, for instance, using open-ended and probing questions rather than closed-ended questions. A phrase that we use a lot is tell me. Tell me how we've been taking care of your pain. Tell me how we have been making sure that your needs are being met. Because the closed-ended questions would be, are we taking care of your pain? Yes. Are we making sure your needs are met? Yes. That doesn't give us a lot of information, and so we want to use the word tell me. Now, I will say that when I've done training with leadership teams on doing this, again, it sounds so easy and so basic, but what we do is a lot of times we will actually brainstorm questions they think they might like to use. They go out and they do lead arounds and they practice it. We come back and talk about it, and then I've even done shadowing with leaders where they're in the room doing their lead around. I'm listening to them. They come out, and then we talk about how that went. Because this is not an easy skill for some people. If you are a nurse, be sure to round as a leader, not as a nurse. What I mean by that is there are 2 different hats, and if somebody who is also a nurse and a leader walks in, it's easy to start asking the patient about the medical stuff and the diagnosis and everything that's related to what brought them in the hospital and the symptoms. So if you're a nurse, you have to specifically think about, okay, I'm going in as a leader. I'm wanting to know about the entire experience for my patient. I'm wanting to know about what we have done well, not just what the nurses or techs have done, but across the board, what has their experience been like? So it's a very slight tweak, but it's very important. The other thing I encourage you to do is to notice the environment and get ideas for questions. And so one of the things that IHI talks about is knowing what's most important to the patient. And so on a lot of communication or whiteboards in a patient's room, one of the questions we will ask the patient is something like, gosh, Mrs. Smith, I'm going to be here with you the next 12 hours as your nurse. What's most important to you? And then she's going to say, oh, I just want you guys to really control my pain. And then we're going to note that up on the whiteboard. So when you walk in, you're going to pay attention to those kinds of things. Oh, I see that pain on the whiteboard. I see that pain is really important to you. What kinds of things are staff doing to help with your pain? See, if we just say, are we controlling your pain, it might be yes or no. But when you get it, what kinds of things are they doing? Then they might share things like, oh, this one tech is so good about bringing me hot packs. Or the nurse knew I had a headache, but I couldn't get any medication for a while, so she dimmed the lights in my room and closed the drape so it was a little bit darker in here. That's how you're really going to get at the experience, and again, not just the yes and no information. Also, the other thing to think about is, again, knowing your culture, what you're really looking for. And so, for instance, one question a lot of times leaders will ask, which I think we need to rethink, is when you hit the call light, are we getting to you quickly enough? To get to a patient in 2 minutes after they hit a call light for something, that's fine. But a lot of the hospitals I work with really realize that patient experience is about trying to be proactive, and it's about trying to make it so that the patient has this experience where they never even have to hit the call light. And so if you think about when you go to your favorite restaurant, and if you're constantly having to ask for the ketchup and the mustard, and, oh, would you fill up my drink, and, oh, I need a knife, and if you're asking for everything, they might get to you really quickly. But that is nothing like the experience where you are in a restaurant and they're anticipating your needs. That's what we need to think about and talk to the patient or the staff about, and really moving away from are we getting to you when we hit your call light, to tell me how we are taking care of some of your needs before you're even having to ask. That's where you get at some really rich information. And then, of course, there are times when the patient is not going to want to tell you what's going on. Sometimes they're afraid because they don't want to get anybody in trouble. Sometimes they're afraid, if I tell you how rude that nurse was to me, she will take it out on me. And so if they look hesitant to tell, if you haven't already, pull up the chair, let them know you really want to hear about this. If they're still hesitant, you could ask the question in a different way. If they're like, nope, I don't want to tell you about it, I just don't want to tell it. Then you could just say, well, gosh, I know you're going to be here for another day. What can we do to make your stay better these next 24 hours? What you might get is what is exactly has been the problem. You might hear them say, you know what, I just wish people would get me to the bathroom before I have an accident in the bed. I just wish they would tell me what the plan is for the day. So you might be able to get at some of that information through the back door. I also know some leaders who will use this, if you had a magic wand, what would you change about your stay? So again, getting creative. None of this should be scripted. There are a lot of ways to ask about this. And then once you do know, then you're able to do service recovery with that patient before they're discharged, if possible. Wrapping up the rounding, thank the patient for their honesty. Let the patient know that, let the patient know that staff love to see their names in surveys. Some hospitals really struggle with getting enough HCAP surveys in, and always looking for new ways to do that. So what you might do is to let the patient know, and this is okay to do, hey, when you get home, somebody might be contacting you to ask you about your stay. You mentioned Mary Jo was such a wonderful nurse and all the things she did. Please feel free to share that in the survey, because then we can share that with Mary Jo, and our staff love to see their names in the survey. So that would be a way to help close the loop on moving what they're telling you in the room to the survey itself. And then lastly, just provide a way for the patient to get to you with further comments. And then my last piece is after the round. So again, it's not done just because you've done the round. It's really important for your hospital to have a way to document your rounds so that the next leader who goes into round with that patient can review those notes. What we hate to see happen is when another leader goes in the next day and says, so how's your stay been? What's been going on? And you just spent 20 minutes with the patient the day before, and the patient was really upset, but you did a lot of great service recovery. And so the next leader going into the room needs to be able to read the notes and know what happened, so they can go in and say, gosh, I know that our CEO, John Thompson, was in the room yesterday and spent some time with you talking about your concern about your pain medication. And I know that you all really worked a lot to resolve that. How have things been since then? By being able to do that, you will show that the leaders are communicating, that you're communicating across the board in the organization, and it gains credibility for you. And it helps them to see that you're not just in there just to ask them and interview these questions, but it's really about this continuity of their care. Then the last thing you do is whatever you hear from those rooms, then you have to go provide that recognition to the staff members who have excelled and figure out a way to do that, and or have a conversation with staff or departments when there are concerns. And that is the biggest next piece, because that's what closes the loop and moves this from just doing a patient round to now making some progress in the way we do things and also developing our staff. So on that, I'm going to turn this over to Shannon Studden, and she's going to talk a little bit about how to provide feedback and coaching to staff. Shannon.
Thanks, Rhonda. So yeah, that's the perfect segue. As Rhonda mentioned earlier, this is really this part is really about closing the loop. So when you've completed your rounds, you've gotten feedback from that patient, making sure, as Rhonda just said, that you're circling back around with with staff who either did a fantastic job or need some kind of constructive feedback and problem solving to do things differently the next time. So just before I get started on this, I just want to say that, as Rhonda mentioned at the beginning of this webinar, a lot of you do rounds already and have established processes. So what I'm going to talk about is not intended in any way to replace or contradict your standard processes, but just to give you a couple of things to keep in mind as you engage in these kinds of feedback conversations. If you don't have standard processes for closing the loop with employees after rounding, but it's something that you're considering implementing, these concepts just might give you a place to start and some things to think about. So just for a second, let's just talk quickly about what feedback does for us, why it's important. So it certainly does some pretty immediate things. So it gives you the opportunity to recognize and encourage behaviors in employees that you'd like to see more of, and it gives you an opportunity to change behaviors that don't promote high-quality patient experience or aren't in line with the values of the organization. There's no doubt that it does that. But there's a lot more to it. There's sort of the lower part of the iceberg involved too. So when providing feedback to employees is a regular part of how things get done within your organization, it does a lot of really important big picture long-term things like support professional development. So thinking about feedback as a way to continue to give up employees an opportunity to grow and learn and develop their skills and build self-awareness is a really important part of what we do, how we engage with employees over the long term. It also promotes employee engagement. There's a study reference at the bottom of this slide that was done in 2018, and the researchers found that healthcare organizations that engage in leader rounds, I think in this study they actually call them walk rounds, which sounds very quaint to me. So when organizations engage in leader rounds with feedback, they have substantially higher safety culture scores and employee engagement scores than organizations who don't regularly incorporate the employee feedback into their rounding processes. And we also know that just generally across all industries, leaders who are really intentional about providing feedback on a regular basis and do it in effective ways have much more engaged employees. And we know that employee engagement is so important, not only for retention, but also just for helping promote a positive workplace culture and having employees really feel invested in the organization and willing to kind of go the extra mile when the opportunity arises. Feedback also builds trust and strengthens relationships. So we know that part of trust means that if I trust you, that means I'm fairly certain you're going to tell me the truth, even if I may not really want to hear it. So sometimes it can go a little bit outside of how we normally think about building trust in a positive environment. But even when we have some constructive feedback to provide to somebody, that goes a long way toward building trust. If it's not always positive, but we also talk about things that could be different in the future, that promotes more trust. And then kind of at the foundation of this period, of this pyramid, the very base of the iceberg, anytime you engage in a conversation with employees, it reinforces your organizational culture, it reinforces values, and it reinforces priorities. So sometimes when these conversations get hard, it helps to kind of helps me think about kind of the bottom part of this pyramid and how much even one conversation can fit into the bigger picture and the overall longevity of the organization. So let's talk just a little bit about what we know about effective feedback conversations and who should really initiate these. So what we know about feedback is it's most meaningful when it comes directly from the source. So if a patient experiences something or observes something, theoretically, it's the most meaningful for the employee to get that feedback directly from the patient. It has greater impact. It allows for two-way conversations for better understanding. We know that's not really part of rounding, so I'll talk about that in a minute. But we know that when intermediaries deliver the message, there's less opportunity to ask questions. There's more opportunity to kind of discount the feedback as a misunderstanding. The message can kind of get diluted Some of you may have played the telephone game when you were younger at slumber parties. So the more people you put kind of in the middle, in between the original source and the target of the feedback, the more muddled that message gets and the harder it is to receive as the person getting the feedback. But we know that without an intermediary, lead-arounds wouldn't really be lead-arounds, and we'd lose the benefits that come from lead-arounds. So leaders would be much less likely to get honest feedback from patients, probably if patients were delivering that directly to the employee involved. And we'd also lose the opportunity for leaders to connect with patients, to gather information about their experiences, to understand how employees interact with them. So really, if we think about this in the context of lead-arounding and the intention of lead-arounding, the way to make the feedback as meaningful as possible is to have only one intermediary, which would be you if you're the one engaged in rounding. So whoever the person is who engages in rounding, him or herself, the ideal situation is to have that person deliver the feedback directly to the employee. There's, of course, a downside to this, because if you've done rounding with a large number of patients and have a lot of employees to catch up with, that's a lot of feedback conversations to have with employees. So there are certainly valid reasons for passing your feedback on to the employee's direct supervisor, so that the direct supervisor can be the one to have those conversations. So feedback given that way can absolutely still have an impact, but just want to give you that as just something to think about, that for every intermediate step can we add to this process, a little bit of the message gets diluted. So as you're thinking about what makes the most sense logistically for these kinds of conversations to happen, just something to keep in mind. So you may already have some really specific processes in place for having these conversations. You may already have standard steps that you have, and again, this isn't intended to replace those, but if you don't have a really concrete process in place, this is one way that you can structure a feedback conversation with an employee. So it's a little bit like a formula. So you share the situation with the employee, you share the facts or the behaviors, the impact of those behaviors or those facts, and then the response. So where were you? When did you have this conversation? Who did you have the conversation with? What was observed? What was said? What was heard? What was the result of it? And then, as Rhonda mentioned, when you're having a conversation with patients, when you're engaging in rounding, same thing with employees. So a lot of the same principles apply. So make it a two-way conversation. So asking for input, asking open-ended questions. What was going on for you? What do you remember about this situation? What are your thoughts about this situation? And then the other part of the response is, so what comes next? Let's look at a couple of examples. So here's one example. In a situation, so you sit down with an employee, and again, just as when you're having conversations with patients, it's important to kind of have everybody be in the right frame of mind. So setting the stage and making sure that you're connecting with the employee, thinking about your intention, and I'll give you some tips for thinking about that in a minute. But asking if it's a good time to talk. If an employee is in the middle of a really crazy part of their shift, it may not be the best time to have this conversation, whether you're providing really positive feedback or constructive feedback. Making sure that the time is right is important. So it's kind of laying that groundwork when you sit down with the employee to share the situation. So in this example, the situation is, I had a rounding conversation with a COPD patient yesterday, and through the course of the conversation, what she said was that you went out of your way to find just the right pillow for her. So you've kind of dug deeper, as Rhonda encouraged some strategies for doing earlier, getting deeper into what was so great about the visit. And what she said was she just wasn't able to sleep comfortably, and when you found that out, she said you went out of your way to find just the right pillow for her. The impact of that was she slept better. She was happy to know that somebody was looking out for her during a time right now in the course of the pandemic. She can't have visitors, and she really felt that you made her feel cared for. You modeled our core value of putting the patient first. So the impact that your behavior had on the patient, as well as the impact that your behavior had on us as an organization, it was really in line with our values. So then kind of keeping that two-way conversation going. What do you remember about it? What do you remember about your experiences with this patient? And to get their input, and kind of the what next, or what your responses is as a person doing the rounding. I just want to really express my appreciation to you for making such a difference during her stay. So very specific, something that was seen or heard, rather than she just said you were very cheerful, or she said you seemed kind of crabby. Some really specific behaviors. It's very hard to continue to do something if you don't know the specific behaviors or the specific things that were seen or heard. Here's one more example on the flip side. So when things didn't go quite so well, if it's more of a constructive feedback conversation, again, just the same beginning steps. So settling in, making sure it's a good time to talk, thinking about the physical environment. Ideally, we're sitting down, talking face to face. So here's a different situation. So here's a situation. I was in a conversation in the cardiac unit yesterday. I sat down and talked with a patient, and the patient said that he had to wait 30 minutes for help getting to the restroom. That was the specific behavior. The impact, so what's the impact? The impact on the patient is he said he felt like he'd been forgotten, that staff had other priorities, and then the impact to the organization. So this comment worries me because we've been working so hard on improving patient experience, and I'm just concerned that this patient did not have a very good experience with us. So again, bringing in the two-way conversation. So not that you're accusing of anything or ending the conversation there, but let's talk about this together. So what do you remember about this situation? What thoughts do you have about how we can prevent long waits like this from happening in the future? It's very possible. We all know that hospital staff get slammed, and so it's possible that it was just one of those crazy times of the shift. So let's talk about how we can problem solve and maybe prevent something like this from happening in the future. So the more you can keep it a two-way conversation, the more open the other person is going to be to staying engaged in the conversation and working to problem solve, rather than kind of putting up defenses and hoping to get the conversation over with as quickly as possible. So just a couple of notes about what we know about effective feedback, and I've mentioned some of these already, and all of these are really in line with what Rhonda talked about when you think about what makes for effective conversations with patients. So delivered in the appropriate setting, not in public, at a time when an employee has got some time to think about things, provided as soon as possible. So ideally, we have these feedback conversations as soon as we can after we've had the rounding conversations with the patient. The longer we wait, the more patients our staff have had interactions with, and the harder it is to remember the details. Again, structured as a two-way collaborative conversation and delivered in ways that are meaningful to the individual. So just as Rhonda recommended, connecting with what's important to the patient, whether it's written on a whiteboard or in any of the other records, when you can connect your message with what's important to the employee, that will resonate more with them, and they're more likely to really internalize it. So if you know that helping patients is really important to them, then connect your message with how what they did helped patients or did not help patients. Or if it's somebody who's really about keeping things organized and structured, talk about how what they did really contributed to that or did not contribute to that. So that's how we can make those messages the most impactful, is if we can connect with what's meaningful to them. Some of you may have heard of a feedback sandwich. Every once in a while when we talk about feedback or read about feedback, we hear about feedback sandwiches. The idea is, if you've got some constructive feedback to offer, you start with something positive, deliver your constructive, the feedback about things that you would like to see done differently next time, and then end it with something positive. And what we know about feedback sandwiches are they dilute the important message. So going back to the example of the patient who had to wait to get help getting to the restroom, that's an important message that just needs to stand on its own. And if you try to kind of soften it by talking about the positives, it can dilute that message. And that doesn't mean that if you get one piece of positive feedback from a patient about about an employee and a piece of kind of negative information about that same employee, you shouldn't have that you shouldn't include both of those. But really think about, if you've got an important piece of information to deliver that standing on its own whenever possible. I always have to give a little anti-shout out to feedback sandwiches when we talk about feedback. So again, these are not easy conversations to have. It's very few of us enjoy approaching an employee to talk about things that we'd like to see differently, but it can make it much easier when we stay focused on our goals. So again, certainly our goals are to recognize and encourage behaviors that we'd like to see more of, and to work to change behaviors that aren't in line with our goals. But really, if you can stay focused on how these kinds of conversations really build the kind of culture that you want in your organization. They reinforce the values of your organization and build trust, support employee engagement, support professional development, all those big picture things. It can kind of help keep you focused on what's important. And I will leave you with words of wisdom from Harvey Firestone. Seems like a strange guy to bring in on this conversation, but Harvey Firestone founded Firestone Tire Rubber, the Firestone company that we all know and love. And the fact that this same company exists 120 years later hints to me that he was onto something. So even way back in 1900, Harvey Firestone approached his employees this way and really felt that the growth and development people is the highest calling of leadership. And so the more you can build this culture of feedback into your organization, the better opportunity you're providing your employees to grow, the more you're reinforcing your culture. It really is a critical aspect of leadership that goes such a long way to thinking about your organization and your employees in the long term. So whenever you can approach these conversations with a growth and development mindset rather than a kind of a gotcha or I hate to be the deliverer of bad news, or kind of check the box on having these conversations, it can help keep you engaged in the conversation even times when these conversations get difficult.